Ourselves a great show lined up for you this evening. We have it's been a month since we've had the Fab Four. Let's just do it like baseball, okay? Dr. Larry Bookman, Dr. Dwight Sublett, Dr. Dale Bratzler, Dr. John Armitage. We should have walk-up music like in a baseball game for you guys. So great to see you all. There is a whole lot of news, which means the first thing I should do at this very moment right now is get out of the way. Lots of news, federal level, state level. Dr. Bookman, take it away.
Thanks, Scott. It's good to be back. Feels like it's been a long time since we've been together. We do have a lot to talk about tonight. I want to first get into really what is the most confusing, I think, for the public. Confusing for my wife and for myself. We're getting ready to travel. So the mask mandate is all over the map. We've got boosters coming up. We've got a lot to talk about. So let's start with masks and see what everybody's opinion is. As we all know, a federal judge in Florida overturned the CDC requirement for mask mandates on our airlines and transportation. It did not make it impossible. People have the individual choice. It was only for transit. But now the CDC today filed an appeal to the federal appeals court to overturn the judge's decision. So, we don't know what's going to happen at this point, but people who are getting on an airlines in the next few days or the next probably week, right now, most of the major airlines have done away with their mask mandates. The airports, however, still have mask mandates in some of those same areas. So let's start with Dr. Bratzler, our resident expert on COVID. And what's going on?
Well, I get it. Wearing masks everywhere isn't popular. And so I certainly understand that. And I think you're absolutely correct to remind people that if you're more comfortable, if you're one of those people with underlying medical conditions, regardless of the outcome of this whole fight in federal court, you should wear a mask. And it should be a high quality mask, an N95 or KN95 at the least. Wear a high quality mask if you're going to do so. Where I've come down on this particular discussion is from some of the early research that was done at the start of the pandemic related to wearing masks. It was work that was done at the Mayo Clinic, and they basically showed that if you're sitting within a foot of somebody and both parties do not have a mask on, there's a 100% chance that you're going to breathe in the aerosols or droplets that come out of the other person's mouth. You can't avoid it. And what a lot of people don't recognize, the four of us are sitting here in front of a screen right now. We're breathing, we're talking. You don't see it, but there are droplets and aerosols coming out of our mouth. You can't stop it. And if you happen to be infected, then if somebody else breathes those aerosols, they can get infected. And so I just think about all the airplane flights that I've ever taken where, I got put into a middle seat, or even if I'm on the aisle or the window seat and have somebody close, you're very, very close to somebody. And despite all the work that the airlines have done, and they've done a lot to improve ventilation, if you're sitting really close to somebody and that person happens to be infected, you are at risk of getting the infection because you will breathe those droplets in if you're not wearing a mask. The other point from the Mayo Clinic study was that if both parties are wearing a mask, it dramatically reduces the risk of breathing in some of those droplets.
Yeah, and as you say, it's real important to stress high quality masks. The N95, the KN95, not just a cloth mask. Those have been shown not to be as effective. But Dwight, we know that kids are now able to get vaccines to a pretty young age, but most are not. 2/3 have not been vaccinated. So how does this mask mandate or the lack of mask mandate on airlines with all the people now traveling, how's that going to affect our kids? Dwight, are you there? Can you hear me? I think Dwight may be frozen. So
There we go. Can you hear me?
There you. Yes.
Okay.
Yeah.
Are you there?
So what about our kids, Dwight? What about our kids? Are they more at risk if we take away the mask mandate?
Well, I think I'm losing you here, Larry. Are you there?
Yeah, we are. But you're going in and out. You may want to go out.
I'm gonna have to back out for a minute.
Okay. So, John, you're always the philosophical one. Masks have become political. I read that several of our larger hospital chains, some are not going to require masks. In Iowa, Houston Methodist, a very large hospital system in Texas, is no longer going to require masks in the hospital. Yet some of our others, like the Mayo Clinic, Hopkins, Trinity Health, are all going to require masks. And actually, out of Trinity Health, they said that it was, and I quote, irresponsive and increase the risk to people for this judge's decision. So what do we feel about this? I mean, we have people all over the map on the mask mandate. We have some who say yes, some who say no, some who say I don't know. I understand that the average public is confused.
So I really want to thank Scott for putting me in the batting cleanup here. So I'm not sure I can do that on masks or anything else, but and I will say that I love Dr. Bratzler's suggestion of doing away with middle seats on airplanes. I think that could be tremendous. But seriously, I think I would love to see some ground rules, I guess, around how to make this decision, both for the individual who it's now falling to, as well as, maybe some of our policymakers. When the hospital systems are in conflict, I think that gives a lot of excuse to whichever opinion you want, right? If experts and people who care profoundly about the health of patients can't agree on what the basics are, I'm not sure where we can go, except maybe back to first principles, which would be, certainly in a hospital setting, which is maybe the most egregious of any location, a mask, we know it's dropped the flu rates. We know it has a benefit for immunocompromised patients in the area. So, putting those principles out front with hopefully statistics, as Dr. Bratzler was mentioning around aerosols, there's some physics that can be brought in. There's certainly some immunology that could be brought in for those at-risk folks that might encourage us to respect their needs. And then there's the general population and the risks for vaccinated and unvaccinated that we should be getting. At this point, we should have some outstanding actuarial data that we should be trying to put forward in a way that hopefully people can start to make those evaluations from the principles. It's not we're letting politics and the maelstrom of personal attacks and all that take precedence over the basic principles. What diseases are you trying to protect? Who are you trying to protect? What are the risks? And what are the benefits of certainly a KN95 or an N95 mask? But we're way away from that, it seems.
And that was really my point for bringing it up is, are we sticking to the science or are we letting politics? And I agree with you. I think politics is involved. And that's a shame. This ought to be the physicians, the scientists, and it ought to be based on scientific data. And I want to get back to that in just a minute. But we've got Dwight back. And Dwight, you're muted, so you might unmute. But we know that unvaccinated children are twice as likely, as CDC just reported, twice as likely to be hospitalized.
Right.
Still low numbers. It was only like 19 out of 100,000. But twice as likely. So what is the mask mandates or the lack of mask mandates going to do to our kids?
Well, I think there's several things there. One thing that's been brought up today, I've heard on news, is the immunocompromised people, and there are a lot of these people that have to travel on the airlines to get to locations to be treated. So even though somebody is on an airplane that is asymptomatic without a mask, that doesn't mean that they can't be transmitting that to the other person, and that would apply to children, with immune deficiency, cancers, things like that. The other thing that I would mention is that we're just at a stage here where we don't know. There's a lot of confusion on the point that, okay, yeah, numbers in the population are coming up as far as number of cases, but yet hospitalizations are low. So I think that is leading to kind of a casual attitude about all this, which is not, in my opinion, a good thing. The other thing I would point out, we still, as far as I can tell, have not come up with any EUA regarding the younger children, the under 5 group. We don't have that covered. We're compliance with the 5 to 11 and also with the 12 to 18 year group. And in terms of vaccination, has not been great. I was looking at that just prior to coming on, and so there's a lot of risk there for kids traveling, and also for kids to pass on the disease unknowing to maybe the elderly person next to them. You just don't know. So I think that it's probably premature to be talking about dropping masks at this point. And it's just, the other thing that just drives me crazy is the fact that, okay, one airline has it non-mask, one agency has it absolutely masked. Certain cities, it's so willy-nilly that's what's got me going more than anything. But bottom line, in terms of pediatric cases, yes, I think it increases the risk for children, adolescents, and also the people that they are in contact with.
So the good news, and going back to what Dr. Armitage has talked about over and over again on previous shows, is the CDC came out yesterday, started a new, I'll call it group out of the CDC for a new analytics team to improve communication about COVID-19, what the future may be, what we're going to need to do, and to try to get communication to people and to the physicians, and to actually have a coordinated effort of communication. Now, unfortunately, the CDC's authority, if the federal courts judge it to be so, may be diminished. And certainly their reputation has been diminished by what's happened in the last few years. But I think it's a good thing that at least they finally recognize they need to communicate better. And they've got a group of 100 scientists, physicians, and other scientists to base this communication on, and they've got an analytic team that's sole purpose is to look at that. John, you've got to be happy that they at least recognize that they've done a poor job of communication.
Well, I applaud the idea of trying to establish, hopefully nonpartisan, scientific, robust CVs and in multidisciplines. I think we could all sit here and armchair quarterback what we would love to see is the composition of that. I hope they come close to a kind of a consensus model of how to build that 100 person team. I love the thought of trying to step up a robust expert authority, and then hopefully they also pay for some people to translate what those people talk about into common language, so that there's some transparency around the debates as well as the pronouncements of that group, because I think the risk is that it becomes a very sophisticated conversation that nobody can follow. So again, I hope they build that into the model. But I love the direction of trying to take holes that we've seen arise in healthcare and public health and address them. And this seems like a great step to me, a first step.
Well, I agree with you. I applaud them, and I hope that they're effective.
Mhm.
Dr. Bratzler, we're now entering a new phase with a second booster, and I want to say, I don't know if you all have, I got my second booster for my fourth shot today, and I'm still alive. I'm still breathing. I'm still here. And it's being recommended for those over 60 and for some over 50 to 59 who are at higher risk. What we're entering into, people wanted to use pandemic and endemic early on. Now it seems like what we're really entering into is what one news reporter I saw used the term sustained management. And that really seems to fit more what we're doing. We have to realize we may be getting more boosters along the way. How do you feel about this, Dr. Bratzler? You're the one dealing with it.
Yeah. So first, I guess I talked to some experts in vaccine development from the NIH, and I asked them about, I think this panel is probably aware, when you look at the studies that have looked at that second booster dose, the fourth dose, it provides some protection from infection. It probably boosts your protection against hospitalization and death, but the actual protection from the infection itself may not last too long. And so the question is it worth it at this point? Because I want to point out that we're still today giving the same vaccines we started giving in December of 2020. They've really held up very, very well. They've provided great protection for those people who've received those vaccines. When I spoke to these experts at NIH, they basically said they could not think of any reason not to get the booster if you're eligible, because there seems to be no evidence that getting too many shots in any way impairs your immune system. And they actually talked about the fact that repeated exposure actually broadens the immune response and may actually help protect you against other variants in the future. So I, like you, will be getting my second booster dose because I'm in that age group that it's recommended, and I feel confident. One thing I'm going to do, which a lot of people haven't talked much about, is that I've received all my previous doses with Pfizer, but my booster this time I'm going to switch over to Moderna because there's some evidence that even though the RNA, the actual content of the vaccine, the part that causes the immune response is identical, the packaging is different, presents it a different way to your immune system. And there are some studies now that have come out that have suggested it may broaden your immune response to switch to one of the other RNA vaccines. So if you got all Pfizer, get Moderna, or if you got all Moderna, get Pfizer. So that's one change I am going to make.
I think I would certainly add that we've seen several countries, especially in Europe, who have had increasing numbers and now are having issues again, China as well. And one of the reasons that I got the booster currently is that I'm leaving in a couple of weeks going to Europe. So I'll be right in the middle of the Netherlands, which is, one of the category 5, the highest category there is of infection right now. So any help I can get, I appreciate. I accept in 6 months, I may need another booster. I know that. And I would recommend for most people who aren't at high risk and don't foresee an immediate need, put it off. There's nothing wrong with waiting till the fall to get their booster. I see nothing wrong with that. But I do feel that the second booster, the fourth shot from the messenger RNA vaccines is going to be important. John, do you have anything to say about that?
Well, I applaud you looking after your health, because I know you just signed a 15-year contract with Scott, so we need you around. But I think you're making informed personal decisions, which lean in the direction of protection, and I would hope everybody's doing the same thing for themselves and their families. The actuarial data that we should have on single boosted, multiple boosted, by age, by outcomes of hospitalizations or illness, we have the biggest N in the history of mankind to deal with here from a scientific basis. And the fact that we seemingly, I love the fact that we've got masking data for kids that seems like it's getting out there with some numbers. We should have such a trove to slice and dice, whether 3 shots or 7 shots over time proves worthwhile. I'm anxious for us to uncork. We talk about artificial intelligence being able to help us. Here's the biggest number crunch that you could ever dream of. Let's get crunching. Let's at least set ourselves up to, we're going to probably start losing the monitoring. We did pretty well with the first and second shots. How long are we going to maintain that, and to what purpose? I hope it's to really good data crunching and understanding. And then you think of the different models that have been run in different countries. There's a trove of data too that we can compare and contrast. And anybody who looks at China right now knows that they've got a different model, and right now they're paying a price for having done probably a very good job up front. But let's get an understanding of what all that means to us from all these different. Sweden, they were probably lambasted for a while there with their caseload, and now they seem to be back in the middle with everybody else, or maybe better. Who knows? But again, I think it's an opportunity. This pandemic has opened up opportunities for us to improve, whether it's the CDC with its 100-person council, or whether it's us looking at supply chain problems that, we have masks now, but for a long time that was not true. And our onshore capabilities. We're looking at a bag shortage, an apheresis kit shortage in blood banking. It's insane to me, with all the challenges that we are facing, that the supply chain is encumbering medicine as it tries to get back on its feet. Test tubes have been short, and swabs, and we need to look at that and say, what does a public health, national security solution, what are the key elements that we want to build and make sure that we have really, really good redundancy on? I haven't seen that report. Hopefully JAMA will have it in the next issue. But somebody ought to be looking at that as lessons learned, and let's get better at this, and let's not face gaps that are potentially life-threatening on the supply chain side.
Larry, I wanted to mention, John talked about data. He may or may not have seen it, but a big study was just published on March 29th, so just a few weeks ago, with more than 100,000 people in the United States who got COVID-19. All had some vaccine. And it was one of the better studies that looked at the impact of having better vaccination. So turns out, if you look, I'm going to just quote the hospitalization data. If you had 1 dose of the J&J vaccine, the one that we know now wasn't terribly good. And by the way, this study went all the way through the Omicron surge. So it's very contemporary. It was only 31% effective at preventing hospitalization. If you had 2 Janssen doses or 2 Johnson & Johnson doses, 67%. If you're one of those people that did like we recommended, you had the first Johnson & Johnson because you only wanted to take one, but then we came out and said, well, you need a booster. So you got Pfizer or Moderna. Mm-hmm. That was 78% effective at preventing hospitalization. But for those people who got 3 doses of the RNA vaccines, it was 90% effective through the Omicron surge at keeping you out of the hospital. And really, that's ultimately what we care about, is the people who get sick enough that need to be hospitalized. So I think the data now are pretty strong that, first, the RNA vaccines clearly seem to be the most effective that we have. And second, getting that booster dose actually did add quite a bit of protection to people through the Delta, through the Omicron surge, and kept them out of the hospital.
I think Go ahead,
Just going to make
Dwight.
a quick point. I certainly agree with you, Dr. Bratcher, on this, and I think it's done a lot of good. The question I have now is, where do we go from here? Okay, we've gone to this second booster. Now, do we have any idea, and I haven't seen it yet, there may be out there, are we going to need a fall boost? You know, is there a protocol being developed that will give us some guidance, give the public, give us as physicians guidance as where to go from this point?
Dwight, let me say, first of all, I do think that we will need further boosting. I think that is pretty clear from the literature. But what also is going to throw a curve in this is that we have some new entities coming on to the playing surface. Novavax, which is a protein-based vaccine. How is that going to be used? We've got nasal sprays so that you won't get a jab. Is supposed to be out by the fall, they hope. And we've got specifically targeted vaccines that are being discussed, possibly being developed. I'm not sure, because we've got another subvariant of the variant. And so, you know, I think the playing field isn't stagnant. The playing field is being broadened.
Great.
Dr. Bratzler?
Yeah, so just today I got an article that Moderna reported their first trial of their bivalent RNA vaccine. So it has the original part of the original virus, and it has the RNA from Omicron. And what they demonstrated in this trial was that the antibody levels were twice as high when the patient got the bivalent vaccine, and it seemed to have much greater protection about getting an infection with COVID-19. So I think, you know, you're absolutely right. There's going to be a lot more research that's going to go on, and I think it's likely that we'll be taking intermittent boosters. We may be crossing over more, but I love this particular study that's showing that putting two different viral strains in one shot gave better protection.
Just curious, I haven't read that article, unfortunately. Were there higher side effects because of a bigger immune proposition?
Yeah, so I haven't seen all the details. I did not see any reports of more side effects, but the antibody levels were doubled in these patients.
John, I can answer at least a little bit in that I read one article on this bivalent, and they stated, they didn't give the statistics, but they stated that there was no increased side effects reported. So, yeah, it seems to be safe and effective.
Just to throw another wrinkle in the story of, you know, what are we going to do moving forward? I was watching, I think the NCAA basketball tournament or something wonderful on TV, and the ads came on for the antivirals that are now trying to position almost like don't worry about it. Not don't worry about it. They don't say that, but the contending thinking would be, okay, they're advertising this help for me if I get it. Therefore, the prevention is maybe not as urgent. That's not the case. I don't think any of us would suggest that. But I think the unintended consequences of having companies now trying to market their treatments potentially takes people off of the prevention a little bit more. So we need to address that. Increasingly, the corporate influence in the conversation will amp up, whether it's choice of vaccine potentially or it's treatment versus prevention.
Dr. Bratzler, there's been a question. You might explain what bivalent means.
Yeah, so bivalent means that they took the RNA, the genetic components of the original virus, the one that came to the United States from China, and then they took part of the RNA from the Omicron variant, the one that just devastated us through the months of December and January. So they put two different pieces of RNA into the same vaccine injection. So you're receiving a shot that has specific protection against Omicron and specific protection against the original virus that came to us from China.
Yeah, bivalent simply means there's two.
Right.
And so that's the two messenger RNAs combined into one. Scott, you said you had some comments. Would you like to share those with us?
Yeah, let me throw these up here. So even though Dr. Sublett has been wrestling technology tonight, okay, so answering questions and wrestling technology is a good one. And this one, okay, this was about your conversation on masks.
I'd like to say that I am not a politician or a judge, so that's true.
or a lawyer. Yeah. No, I appreciate that, Lenny. It's we do this so that we can make sense or try to make sense out of what's going on. Unfortunately, politics is involved, but we try to give the science and the new science and what you can expect, and hopefully give some common sense to what your decisions will be.
I'm not a sociologist, but I would like to throw some wrinkle out there as we talk about masks and we talk about encouraging people to protect one another as the herd. I would hope that we get a little bit more of the group courtesy, the group help argument presented to us than we have previously. It's taken such an individualistic tack in sort of individual rights and autonomy and decision making, and I think we've missed a chance to talk about what it is to help the immunocompromised, as if that's the story we want to make, or respecting people's fears and anxieties. It seems that thread has been very weak in a lot of the conversations. And as somebody who works in an industry that only works based on people's generous caring about one another, the blood donation process we have in this country falls apart if you don't have that communal sense of looking after each other and well-being. And it served us so well in that arena for 75, 80 years. And I maybe we could port over some of that sensibility to, why wear a mask, particularly if we have a resurgence, get people back into masks quicker by recognizing that group element. Same with vaccines, do it to reduce the spread, reduce the vector, its ability to find, purchase, and multiply quickly. All those things, I would love to have a leader who speaks to those, as well as the individual choice and the science and all of that. But I think we've missed something that we could bake back in here pretty quickly if we cared to.
It seems to me like there's some parallels developing gradually here, like we've had with influenza, in that we're having to look at the various strains coming down the pike and making our changes in vaccination based on those changes. And also influenza, yes, we've got oral drugs, but we're still promoting the proactive approach, i.e. getting the flu vaccine and that sort of thing. And that's gradually coming together. I certainly like the idea of getting one message. We've had too many cooks in the kitchen, I think, and you're getting all these splintered messages, and that we need to get back past that so that we do get what John's talking about, communal effort, one working together, I think. So that's my thought on it.
I hate to always go back to the 50s and 60s, but I think the polio vaccine was such a great example of people coming together for a common purpose, a disease that we couldn't see, but we had to fight, and nobody argued about taking the polio vaccine. And that's where we need to get back to in this country. We need to get politics and the judges out of it, let the scientists give a unified message, and have the people cooperate.
You earlier mentioned the hospitals and the contending systems and what they were doing. I think hospitals would be one of the places that you could be maybe ground zero in this kind of herd approach to protecting one another, because there's no better place to make the case that, please, for the courtesy of our patients, consider, please wear a mask, not consider, please wear a mask. It helps, and say it helps immunocompromised, and maybe give some examples of what those conditions are that that the patient population might consist of. And likewise, wouldn't it be great if hospitals always had vaccines available for both flu and, that's part of their new mission, is to say we're about protecting the group. We have a susceptible group all through this institution. This is what you do to play along. Again, who knows where that goes, but the hospitals are in a leading position. I think they are ground zero to make the case about what this new future looks like. I hope they can pull together.
Dr. Bratzler, does OU have a policy?
Yes, in fact, we recently met with all of the systems in the Oklahoma City Metro because our first discussion was about stopping all the routine testing that we were doing. It got very expensive. Every single emergency room patient, every single hospitalized patient, every single procedure you were doing, we were testing all of them. And the hospitals came together. The positivity rate for our testing was so low that we just couldn't justify the expense of testing all of the people that were coming to the hospital anymore. But we all agreed to one decision, and that was that if we're going to make this decision that we're not going to automatically test everybody that comes in, now our policy is that we test symptomatic people. But if we're not going to test everybody, that means that we could potentially be exposing other people to COVID-19, those people who are asymptomatic that don't even know they have it. So we all kept the mask protocols in place for patients, visitors, and healthcare providers in the hospitals in Oklahoma City.
Okay, very good. Well, that leads me to a nice segue in with testing, because we don't talk about testing much anymore. And for a while, that was the big topic. But we've come up with an EUA for a new oral test, a breath test, basically, to detect COVID-19. That's very good. It's 99% accurate if they're negative and 91% accurate if they're positive. It's being released under the name Inspect IR. It's a COVID-19 breathalyzer. So we no longer have to swab our noses either at home or going to centers. This should be much cheaper, much easier. Dr. Bratzler, is this something that the hospitals are looking at? It's available currently.
Yeah, so no, we haven't had that conversation at all. We tried to roll out for certain populations of patients antigen testing, simple antigen testing in our hospitalized people, particularly those people who had tested positive, but now we were trying to get them out of the hospital. PCR test will stay positive for weeks and weeks. And so when you're trying to transfer a patient somewhere where you had to show that they weren't infectious anymore, we wanted to do antigen tests. And it was quite logistically challenging when you have a system that was built around PCR testing. So we haven't talked about the breath test at this point, but certainly something to consider.
Dwight, what about with kids? The breathalyzer would be far less invasive than sticking something up a little child's nose. You get results in under 3 minutes. It looks to me like it could make a big difference, and it can be in doctors' offices.
Oh, I think it would make a big difference in that 3 minute turnaround when you're in the middle of winter is definitely a very.
You're muted, Dwight.
Yeah, I know. I think it would be a very attractive item to have it where you have a quick turnaround, particularly in the winter months when you're that sort of thing for office purposes, and possibly even having a situation where you could have a parent do some testing at home. So yeah, that would be good. And kids would love it a lot more than getting things stuck up their nose. They don't get a big thrill out of that. So yeah. I think I hope that works out and it's an accurate test. And I think it would be well used.
Well, since I'm always complaining about the holes and gaps that have been revealed by the pandemic, I should also celebrate new technologies, being able to come to the next challenge with a head start with oral or nasal or whatever the new technology is. I think we're gonna benefit from that. It's a silver lining to a very dark cloud, but I think it's the progress of mass screening has advanced, along with obviously the acceptance of mRNA vaccines, which were already in development for many years. But we've probably seen an acceleration of our ability to deliver testing. Yay for that.
Well, I think the new technology will continue to roll out, and I think that's one of the positive signs that's come out of the pandemic. I'm not sure any of this would have been developed. Messenger RNA has been worked on for a long time. I don't know that it would have been out into the public like it is now had it not been for the pandemic. And now we can use messenger RNA for all different types of vaccines. So I think there is some good. I don't want to overlook a million people who have died, more than 15,000 Oklahomans who have died. I don't want to minimize that in any way, shape, or form. But, I think if you look for any kind of silver lining, it's been the progress in science, and we need to promote that. One of the interesting articles that I read this last week was that in people over the age of 50 who had COVID, had a 15 to 20% chance, not increased chance, but 15 to 20% chance, 1 in 5, of developing shingles. Now, we have a shingles vaccine as we go into other vaccines, but most adults have not taken it, unfortunately. I'll go to Dr. Bratzler because he sees more clinical than John or I do, but have you seen any increase in shingles? I actually saw a case just this last week in a dinner group that I had, a gentleman complaining of pain and couldn't figure out why he was having this pain, and he had shingles.
Yeah, so I have not, other than very early in the pandemic, right after we had started giving the vaccines, I saw a patient come down with shingles, and probably very coincidentally timed around the time that he got the vaccine itself. But it's the last case of shingles I've seen in a while.
Dwight, I don't know whether you've heard any of the pediatricians talking about it. It's, for people over the age of 50, so it wouldn't be in the pediatric population, but I found that to be very interesting in people who are having pain on one side and what's called a dermatome, or a sort of a linear area. Need to consider that and maybe suggest to their physicians that may be what's causing their pain before they have eruptions. John, you're
I
chomping
think
at the bit.
Yeah, I am. Whether it's HPV or it's shingles or quite a lot of vaccines that help us. I think if you believe in vaccines, we should develop the marketing tools that celebrate the victories. You just have to show a few blisters of shingles or HPV and what it can do to somebody internally. I think we have an opportunity with the successes of other vaccines to reinforce what we want to do with COVID and flu. So yes to vaccines, yes to all the protection, and in some cases there's some pretty dramatic visuals we could bring in to help with a public that really responds to images. They don't respond to words anymore. Depth is not what we're after here. We're after making an impression, and I've seen enough dermatology books to know you can make an impression, and we should. It should be in our interest to get out there and show the pros and the cons.
And I can tell you from at least my years in clinical practice, the pain from shingles is severe. It's incredible. And the vaccine has not been promoted. I am sad to say that I didn't realize I had never had the vaccine, and I got it about, 3-4 months ago. You have to get one shot and then wait a few months to get a second shot. But for those who are over the age of 50, again, you need to consider all the different vaccines, and the shingles vaccine is just as important as the COVID vaccines. So Strongly encourage them.
It'd be
I think we
interesting.
should do some rebranding of shingles, nerve-ending virus, as opposed to something nobody can understand what it is.
Yeah, especially if you ever had chicken pox. Dwight?
Well, I'm just thinking, what's the process there? And of course, we don't know for sure. But is the COVID virus somehow activating varicella zoster, where it's been dormant and probably would have stayed dormant? Now, with COVID, somehow that's turned that virus on and it's gone on to activate the shingles process. So I agree with you. I think if we can protect ourselves against something, we need to be doing that. And because there may be some things that we find out down the line that we're having some cross reactivity there between the viruses in our system. So
I'll let Dr. Brasser talk about the clinical part, probably knows much more than I would know. But I can say that we know that shingles eruptions occurs in times of stress, and the more severe COVID you had, the more likely you were to have the shingles. So I do think stress on the body has something to do with it. Dr. Brasser?
Yeah, so it kind of gets to, I wanted to comment on something that John was talking about earlier, the companies that are out very actively now promoting the antivirals, which I'm really happy about because they're underutilized for people who test positive. But the one point I keep making to people when it comes to making decisions about getting vaccinated is, you're probably going to survive, but you don't want to get long COVID. And very, very large meta-analysis came out this week that showed that the risk of long COVID is almost 43% of the patients will have some persistent symptoms. And we know that there's immune system activation. So my bet is that somehow with the stress of COVID and the immune system activation, somehow it's allowing the shingles virus to the chickenpox virus basically to escape the protection that you've had for years and now causing clinical shingles. So I don't know the exact mechanism, but I know one thing: I don't want to get COVID because I don't want to have long COVID.
I think that's an excellent point that we've not discussed in a while. And we've talked about long COVID, the neurologic, the brain, etc. in the past, but we need to keep reinforcing that there's reasons to avoid even mild COVID symptoms or infection. It doesn't have to be serious infection. So hospitalization, we want to avoid, but we want to avoid long COVID. We want to avoid all the complications. You want to avoid shingles. So, I stress to everyone to consider your vaccines, talk to your doctors, talk to your primary doctors if you've not had all the vaccinations that you should be getting. They're there to help you, not hurt you.
There was a study that came out just recently from the UK, which is just one of my favorite studies to talk about why you don't want to get long COVID or COVID infection in the first place. A very interesting study that said 785 people above the age of 50 who they were doing serial MRI scans of the brain, basically taking pictures of the brain in these people serially. This was a study of brain aging, looking at what we could find from that. But during this study, 400 of those 785 got COVID. And what they showed when they compared the brain scans from people who got COVID to those same people that did not get COVID, that were in the same study, there was substantial brain shrinkage in the group that got COVID-19, particularly in the areas of the brain that control your ability to smell and taste, not surprisingly. And what's not known is it reversible? So again, it showed very hard evidence that getting COVID can result in substantial changes, even in your brain.
Very good.
I gotta say, brain shrinkage sounds like something I seriously want to avoid.
Well, that whole thing with the long COVID has been a big concern in the pediatric community because a lot of these children have been asymptomatic or mildly symptomatic with these diseases. All the latest one put more of the kids in the hospital. But is this going to hang on? And are children that got maybe an asymptomatic case going to be dealing with problems as they get into their adult life as a result I don't think, of course, we don't have that information yet, but that is a very good point, Dr. Brassler.
But parents need to realize it. So, we only have a few minutes left, but I wanted to bring up, John sent an article that I found amusing. I'm sure it's real, called Pandemic Foot. And the pandemic foot disease, for our podiatry colleagues, I guess is becoming more common. I don't know if I should use the word rampant. John, you want to discuss what pandemic foot disease is?
Well, I just thought it was amusing because unintended consequences and ricochets. It seems like it's mostly a mechanical issue with people who have gotten into a very sedentary lifestyle and race back to activities, or maybe they don't want to go on the subway, so they're doing long walks, in place of new activities essentially that are caused even by the pandemic. But it's podiatrists are apparently seeing a lot of people who get overambitious to return to an active lifestyle and haven't had the support of shoes the same way. And some of the, I guess the connective tissues softened up a bit, under those lack of support conditions. And, there they all are having these foot problems. I just thought it was a kind of an interesting footnote to the COVID pandemic.
A little pun there with footnote. Plantar fasciitis, ankle injuries. I know even in my neighborhood, everybody was out walking. Never used to see people walking. One of the side effects of the pandemic is people working from home. They have more time. They go out. They take long walks. Pickleball, for those who have taken that up, which I'm one of those idiots. We're going out, running around like we're 20 years old. So injuries are commonplace that we wouldn't have had otherwise.
So be careful if you're getting back into your high heels, I guess.
That's right. Absolutely. So with the few minutes we have left, I'm going to call Scott back in and see if we have any questions. I always feel bad when we don't get to questions. So, Scott, have we gotten any questions from listeners that we need to be answering?
Well, we have most of you guys have been saying things people agree with. So when you were talking about taking politicians out of the calculus and lawyers on health issues. So Janet Timberlake agreed, that's what she has to say. Julie Lovegrove has to say this. That's a groundswell. You should file. Well, it's too late to file for office. And also when Julie was on just a minute ago, she said this. Sounds like somebody who knows.
Yeah.
I've known Julie for a very, very long time. Does great work in our community, and that is no lie, as they say out there. So for the most part, you and Dr. Sublett have gotten lots of votes tonight.
Well, we appreciate all the listeners, and certainly if you have questions, I encourage you to send them in because we do want to try to answer them. This is a unique opportunity with people in different areas of medicine. Certainly Dr. Bratzler, nobody sees more COVID and talks about COVID more than he does statewide. So please feel free to send questions in. We appreciate it, and we look forward to it.
I have one quick question.
Sure.
That looks like a movie prop from the old series Dallas behind Dr. Bratzler. That like J.R. Ewing could have had that in his office. Can you tell us what we're looking at back there?
You're muted.
It's an oversized leather chair. You can see my wife is a barrel racer, so she's very much into Western decor. And of course, you can see my golden doodle that's stretched out on her right now behind me. So we have lots of things that are quite Western. She is a big time barrel racer.
Okay, so that's not a lightweight activity, for heaven's sake. So all right, so we've always given Dr. Bookman like great great ratings for his
background's great.
his background. Dr. Sublett always, well, he really throws the Sooner at us. We never know where Dr. Armitage is going to be. Tonight it's kind of neo late night at the movies.
Yeah, I'm streaming Netflix while watching you guys.
Okay. So did your price go down today?
I'm kidding.
So we have a lot more viewers tonight because of so many Netflix viewers who came over tonight, but based upon the fact that, I don't know, this was the first time in how many years that they had subscriptions going down. So
yeah, well, their stock lost big time. So, for those of us who own Netflix stock, come back.
I can tell you what's on the chopping block around here when you start looking at how many streaming services. But here's what we do want to tell you is, like, we should have, Dr. Bookman, since we started this, we should have, remember the old McDonald's Golden Arch used to say billions and billions served. We could say millions and millions served since we started this. And two things: you don't have to have a monthly subscription, and there's never a paywall to watch Health Watch Oklahoma. Never a paywall. No pop-ups, none of that. So
and there's always some humor to it. So
and one more. There's Larry came in tonight. So love this discussion with all the doctors. Right now, you guys' positivity rating is somewhere in the 80%.
Oh wow!
Give us time. We can blow it.
We can blow it.
All right. Well, I just want to thank everybody for listening. We'll be here again next month, and we'll see what's going on and try to answer the questions.
Oh, we appreciate you guys. The Fab Four rides once again. It's good to have everybody back. See you next month. Reminder: we're doing Beyond the Bell on Mitchell Talks Saturday morning, 10 a.m. And we're gonna be busy Saturday morning, 10 a.m. and then of course here on Monday night at 7 p.m. So for all the docs, all Fab Four and me, wishing you a happy evening, and we'll see you next time. Good night now.
Good night.
Right.